Hi, myself Doctor Sai Krishna. I'm a consultant dermatologist and cosmetologist at Kolors Healthcare. Today I'll be discussing about dandruff treatment. Actually, what is dandruff? It's a mild form of seborrheic dermatitis. How will you identify dandruff? It is characterized by dryness of the scalp with white flakes and a mild inflammatory reaction. So most of the people will be complaining of dust particles or whitish particle falling on the shoulders, commonly over the sheds. It is called dandruff. So what are the causes of dandruff? So causes it will mainly external factors as well as internal factors. External factors include excessive exposure to dust and dirt and excessive usage of cosmetic creams over the hair, waxes, sprays, and even lack of personal hygiene causes. Whereas internal include allergens, sensitivity, hormonal influences, and few genetic predisposition. So we'll be identifying as white flecks all over the body or even clots appearing on the skin. How will you treat the dandruff? Dandruff can be treated mainly with the shampoos and well as lotions. Shampoos mainly containing ketoconazole, zinc pyrithione, and even cycloperoxylamine, selenium sulfides. These shampoos has to be applied every twice a week or even 3 times a week. And this shampoos has to be applied over the wet scalp, and it has to be left on the scalp for 2 to 3 minutes. Then we have to rinse with a hot or cold water. Topical lotions can be used with like mild steroid lotion in case of severe form of seborrheic dermatitis. Even coal tar or salicylic acid preparations can also be used for the treatment of dandruff. But all this has to be taken under the supervision of a dermatologist because it has to be maintained only for 2 to 3 weeks depending upon the severity of the dandruff person presents. So if you don't treat the dandruff properly, what happens is it may result in secondary complications like folliculitis, secondary pustulosis can occur, even folliculitis decalvans like conditions can also occur. So in that condition, you have to take a proper systemic antibiotic, that is tablet form, along with the topical antibiotic application, and it has to be repeated for 7 to 10 days minimum. So then the pustule gradually results. It can occur secondary complications like scarring, hair loss can also occur. So better to take treatment dandruff in the early stages with the proper topical preparations. And one more thing, never ever use vinegar solutions or some online products. Usually most of the people are using long citric acid preparations like lemon. So never, don't use all those products. Use proper solutions or dandruff shampoos prescribed by a dermatologist. Don't use personal aesthetic products over the hair like wax creams, which can lead to negative social impact. Along with negative social impact, life can result in the overgrowth of yeast, which further complicates the dandruff. So take proper treatment for dandruff, which is a small condition in the early stages, and proper maintenance. It will be good for you.